Well, hello there. My name is Rebecca, and I will be conducting a cranial nerve examination on you today. Now, I am a trainee student doctor, and this may be the first official cranial nerve examination that I have carried out. But not to worry, because I have lots and lots of notes. I do. So, pens at the ready. Right, okay, so the first thing I have to do is I have to take your details. So could you start with telling me your name? Okay, how do you spell that? Okay. Okay, good. Now I need your date of birth. Good. Now, do you have any pre-existing medical conditions that I should be aware of? Okay. Yes. And do you take medication for that? Okay. Good. Now, some portion of today's examination will involve an eye test. So, do you currently wear glasses? Okay. And would you normally wear glasses then for an eye test, like at an optician's? Okay, that's fine. Good. Now, is there any particular reason why you wanted to have one of these today? Or they were just offering them because it's a student doctor? Okay, well, do you have any concerns, any worries? Just thought it would be interesting. Okay, fun. Alright then, well, let's just jump straight into things. I think that's the best way to do these things. So it says, this examination is not going to harm you. We are just simply testing your cranial nerves. So I've got a diagram somewhere. Bear with me. Got a diagram. Okay. Not that one. This one. Okay. Here, as you can see, is a chart about the cranial nerves, okay? So we're going to be testing the 12 pairs of nerves that are cranial. Okay, good. So we're going to test the olfactory nerve, the optic nerve, the oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, the accessory nerve, and the hypoglossal. Okay, got through all of those, and just as a little bit of fun, I don't know if you want to hold this just to sort of comfort you throughout the examination. When I kind of started my training, I noticed that a lot of patients would get quite nervous, especially during quite detailed examinations. So I started to collect little stress toys. So I thought this one was quite fun. So as we're going to, you know, well, it's sort of, it's to do with your brain, isn't it? Yeah. So I thought this would be appropriate to hold on to today, if you would like. No, it's not a real brain. No, it's just a little toy. Yeah, and there you go then. Your brain. Yes, well, I would say that it's quite life-sized, I think. Yeah. Okay, let's get on to the first test. So what do we have first? The first test is testing the olfactory nerve. So that's your sense of smell. Okay, so what I need you to do is I'm going to ask you to just identify the scents that I'm going to put under your nose. Okay, so I have a selection of different, they're a bit like essential oils really, and we just apply them to a little bit of cotton and wave that under your nose, and you just identify it for me. Okay, so let's get the first one and apply a bit on. Okay, right now, before we begin, do you have any issues with your sense of smell? No notices to any changes at all? Okay, so you think it's just fairly normal. Okay, great. These should be easy for you then. Alright, so let's just hold this under your nose. And if you'd like to identify that scent for me, please. Excellent, that was peppermint. Correct. Okay, let's get your next one up. Let's get that bottle. Okay then. Apply that to here. Okay. Ready? Okay. I'm going to hold this under here. Okay, do you want to identify that scent for me? Very good, that was ginger. Actually, sometimes I found that it's made people sneeze. Yeah, you're right. Okay, can be a little bit strong. Okay, let's get the next bottle. Another bit of cotton. There we go. Apply that on. Okay, ready? What do you think this one is? Almost. It is a herb. Basil. Very good. It always makes me think of Italian food, and then I get very hungry whenever I smell basil. Okay, but as you're doing so well, we'll just do a couple more. Normally the recommended amount is, around 5 to 10, but I think we just need to do 5 today. Okay then, so let's do a couple more. You're doing really well though. Oh, I need to get some more of this one. It's running a little bit empty. Okay, great. Let's just have a little smell. That one is orange. Well done. It's a nice sort of fresh scent, isn't it? Yeah, lovely. Okay then, and just one more. Let's see if you can make it a full house. Okay, I think it's going well so far, don't you? I think it's going well. Yeah. Okay. Oh, exciting. exciting. Okay, and the last one. This is a nice relaxing scent. Very, very good. That was indeed lavender. Okay, let me just make a quick note then to say that you got all of those right. So patient detected 5 out of 5 scents. No change in smell. Tick. No concerns. Tick. Further testing required. Okay, so now we're going to move on to the next part of the exam, which is going to test your optic nerve. So in other words, those eyes. Okay, now we're going to start with a test that you may be familiar with, but before we do that, I just need to ask you to step behind at that little blue line on the floor. Yeah, that's great. Okay, I'll just step. Yeah, about here. Okay, so this is called a Snellen chart, and you may have seen this when you visited the opticians. It's fairly standard, and all I'm going to ask you to do is to cover one eye at a time, and just simply starting from the top, work your way down. Do this nice and slowly, please. And if you get stuck at all or you're unsure, that's where we'll stop and we'll switch over to the other eye. Understand? Great. So pick an eye of your choosing and just cover the other. Okay? And when you're ready, starting please from the top. Good. Not too fast. Good. Okay, and can we move on to this line now, please? Great. And we're coming down to the final 2 lines. So let's do this one, please. Just here. Okay, well, what we'll do then is we'll move on to the other eye. Okay, make a mental note of where you got to there. So when you're ready then, starting from the top again. Okay, starting with this one. Good, and the next line please. And moving on to line number 3. And line number 4. Good. Coming down to line number 5. Good. And now line number 6. Good. So this is the line we stopped on last time. So line number 7. See how you get on. Oh, great. And line number 8 then. This one. Okay. All right then. So just a slight difference, but nothing major. So what I want you to do is stay where you are. And what we're going to do is it's going to be the same thing with covering one eye at a time. But this time I'm just going to ask you to identify how many fingers I'm going to be holding up. Okay, so when you are ready, please just cover one eye and we'll get started. Good. 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 I felt like doing a little like peace outside the peace. Okay, and good. Good. Okay, and you know how this works now. Let's try the other eye. Okay, so when you're ready, please cover the other eye and we'll do the same again. Okay, and let's start with good. 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 I think of what I haven't done. Great. Okay, perfect. Well done. Now, what I'd like to do next is wait. Let me just better refer to my list. Okay, wait a sec. Optic nerve. We've done the Schnell and Chartic. That was fine. Minor difference in eyes. Okay. We've done the identify finger numbers. That's good. Oh, okay. So test number 3. We need to move on to the oculomotor nerve. So this is a motor nerve, and this tests pupil reactivity. So I'm going to start by shining a light in the eye, one at a time. Okay, right. Start with that then. So you could come back towards me. I've got my 2 little torches, so you can pick which colour. So we've got the silver, we've got the black. The silver one, okay. Right then, check it's all okay. Right, so we're going to shine the light in your eye one at a time. Okay, so just look right at me. Okay. Good. Do I have to do anything? No, it just says shine the light, so just do that and do that. And I think I remember from my training, we can pull the light back and light like this just to see how the pupil actually reacts. Good. You're doing really well. I know it's quite hard not to blink, isn't it, during these bits? Okay, great. Good, you're doing really, really well. And I'm just going to move the light from side to side quite quickly. Good. Drawing it back and forth, back and forth, and there we go. Good, good. Now, what does it say next? It says, move finger towards patient's nose. Okay, I can't remember this from my training. But then it says patient look up, down, diagonally and laterally. Okay. Right, so finger towards patient's nose. Okay. Okay. Oh, I remember. Yeah. Okay. So your pupils like focusing. Yeah. Okay. Great. doing really, really well. And now I'll just have a little look at your eyes. So if you could look up for me, just while I observe your eyes. Okay, look down and to the side. Okay, great. Okay, I can't see any causes for concern, so let's make a little note of that then. Okay, good. Now the next nerve to do with the eyes still is the trochlear nerve, and that funny enough says to look down. Oh, I have to look into your eyes. Maybe I'll use a torch for this as well. So just look down for me. Okay. Okay, that all looks pretty fine to me. Good. Okay, 4 ticked off already. Great. Alright then. Well, I did actually had some colour blindness tests. I thought I might need that, but it's not saying that I do. Do you want to do them anyway? We could do them. We could do them for fun. Yeah, let's do them for fun as I've got them out. Okay. Right. Thanks for being such a good sport. It does help with my training. Okay. So we'll do 1, maybe 2. I don't know. So you can keep both eyes open for this then, and what we'll just do is we'll move from the top and work our way along. And I just want you to identify the number within the circles. Okay? Now, do you think that you have any problems when it comes to colour and identifying colour? Okay. Alright then, well, let's give this a go. So when you're ready, okay, number 1. Not that that's number 1, just, you know what I mean. Good. Yep. And then this one here. Good. This one. This one then. And covering with my finger, this one here. Okay, okay, just one that you got wrong, but let's do another one. Okay, just to be sure. This one here. So the exact same thing, and just take your time. Okay. So this one then, and this one. Okay. This one, and moving down to this one, please. This one next, and then this one to finish off. Okay, very good. Let me just make a couple of notes. Right, so patient got 1 incorrect on colour blindness test. Oculomotor nerve functioning, trochlear nerve functioning. Okay, so that is the optic part of the examination complete, I think. Just double check. Yes. Okay, good. So we're now on to nerve number 5, and this is the trigeminal nerve. So I need you to please hold your mouth open and I will try to close it. I'll put my gloves on for this. Nothing against you, just, you know, hygiene standards. And there we go. Okay, so I've just got to try and close your mouth. Okay. Oh, I think I remember practicing this with my student doctor partner. Yeah, you know when you're like partnered up together and you do your little test. Well, I mean you wouldn't know, but I mean anyway. Okay, so just open your mouth, please, and I'm going to try and close it. Okay, so you try and resist. Good. You've got a strong jaw. Good. Okay, great. Now the next part is I have to touch your face with a bit of cotton and ask you to identify which areas are being touched. Oh, and you have to close your eyes. That's what I remember. You have to close your eyes. So let me get a little bit of cotton. Yeah, that's fine. It's a little bit like this. Nothing scary. And I'll show you what it feels like with your eyes open. So, boop. Okay, good. So, if you'd like to close your eyes, please, when you're ready. Okay, then. So we're going to do that bit, and if you could identify where that is, please. Okay. And we'll just do over here. And where do you think that is? Okay, very good, very good. And I'll just come just here. And if you could identify that bit, please. Good. And then I'll just come just here. And where do you think that is? Okay, good. We'll just do 2 more. So, let's try just here. Could you identify where you think that is? Okay. And last but not least, let's try just here. Excellent. Okay, then when you're ready, if you'd like to open your eyes. Okay, good, you did it very well. So let's just note down the mouth test, so that was fine. And then a cotton bud face test, that was fine. Oh, and now I've got to brush your eye with a little bit of cotton. I'll try not to get any in your eyes then. Okay, and I've got a response that you should do. Okay, so just, eyes open normal, do one at a time. There we go, that should be fine. Okay, right then, so just I'll be very gentle. Okay, good. You were supposed to blink and you did blink, so well done. Okay, good. Now, this is another one to do with the eyes. This is the abducens nerve, where you just have to move your eyes from side to side. Seems quite easy. Okay, do you just want to move your eyes from side to side? Okay, seems to be functioning normally. You've not got any pain or discomfort in your eyes? No. Okay, great. So that's fine. Oh, we're on then to nerve number 7, the facial nerves. So I need you first to please smile, raise your eyebrows, and keep eyes and lips closed whilst I try to open them. Okay, so you're going to do a smile that's like this. Raise those eyebrows and keep those eyes closed, and I'm going to try and open your mouth and your eye. No, just the eyes maybe. Okay, right, can you do that please? Okay, so let's try and open those eyes. Just resist. Alright, just stay like that. I'm just going to try and, maybe I'll try and like just part your lips. Okay, and open those eyes. Okay, good. That was all fine then. And apparently I've got to place something on your tongue. Okay. Well, we better do that. Let me find is that the correct jar? I have 2. Bear with me. Okay, good. Let me just dip this little swab in. Okay, right then. So open your mouth, please. I'm just going to place this on your tongue. It's nothing horrible, don't worry. Okay, so place that on. And could you just identify that taste for me? That is indeed salt. Well done. Let me get the other one prepared. Dip that in, and okay, place that on there. And could you identify that for me, please? That is sugar. Very, very good. Well done. Okay then. Well, by the looks of it, we're on to nerve number 8. Okay. Now this is the acoustic nerve, which is a sensory nerve, and this tests your hearing. So basically, I'm going to ask you again to close your eyes, and I'll either do a little whisper, I may say some words, or just simply rubbing my gloves, and you can just identify which side I am doing those things. Does that make sense? Okay, good. Now, do you have any existing problems with your hearing at all? Not that you're aware of. Okay. Well, as you can see now, the red line that's on the floor, could you just stand by that, please? Perfect. Now, what I'm going to do is I'm going to just be making a little bit of noise, maybe a whisper as well, side to side, and with your eyes closed, I just need you to identify which side of you that I'm making the noise. Understand? Okay, great. Let's go ahead and try that then. So when you're ready, please just close your eyes. Thank you. Okay. Hello, hello, hello. Good. Testing. Tried to catch you out there. Okay. Hello. Very good. And now let's try. Hello. Good. Hello. Good. Okay, and now I'm just going to say some words and you just repeat them back to me, okay? Apple. Okay, great. Orange. Good. Broccoli. Good. Banana. Good. Tangerine. And walnuts. Okay then, now you can open your eyes. Very good. No problems there. So, tick, tick, and tick. Well done. So now we move on to tests 9/10. We normally do these together. So this is to test the glossopharyngeal and the vagus nerves. Okay. So I need to touch the back of your throat with a little applicator, and I'm just going to ask you to swallow. And then to test the vagus nerves, I ask you to say "ah" both high and in a low tone. Okay, so let's get the little clean applicator. Where's that? Great. Okay then, so if you just like to open, thank you, and let's just do that and swallow and again. Okay, and now could you please say "ah" for me in a nice, as high a pitch you can go. Okay, and now in the lowest pitch you can go. Okay, good. Everything looks fine. I think I'll just have a little look in the mouth as well, just to make sure everything looks okay. Can never be too thorough. Okay, let's just have a little look. Okay, do you go for regular dental visits? Okay. No problems with the taste, as we discovered earlier. The surface of the tongue looks in good condition. No signs of a geographic tongue. Oh, that's just where it can go a bit patchy, and it's kind of nicknamed that because it can look a bit like a map. So, but your tongue looks fine. Sometimes it can be irritated by things like acids and sugars. That's fine. Teeth look in good health. No bad breath. It's always good. Okay, great. Now we're going to be testing nerve number 11, which is the spinal accessory nerve, and this is a motor nerve. So I need you to shrug your shoulders and turn your head side to side, just like that. Do you want to give that a try? Okay. Good. Good. Oh, that looks fine. Another tick for you. Tick and tick that one off. Okay then, let me just double check before I actually say this. No, this is definitely the last one. Number 12 is the hypoglossal nerve, and this is a motor nerve. I need you to stick out your tongue. Oh, I've already done that. And move it, that's right. Moving your tongue. I thought it was going to say like checking your mouth. That's fine. So just stick out your tongue for me, and just sort of wiggle it about. Okay, great. Well, I have to say, I think that went very well. How did you think that went? You think it went well? I agree, I think it went well. So that's good. Let me just summarise everything for you. I've been told that's a good thing to do. So to sort of summarise, we started with your olfactory nerve, the sense of smell. There were no causes for concern there. We then moved on to your optic nerve, where we did a variety of tests, including the Snellen chart, some colour blindness tests. We also did some tests with the light, and I examined the eyes. There was no real cause for concern. There was a slight difference in visions with one of the eyes, but that can be very common, and it's not a significant difference for me to investigate it further. So that's good. For oculomotor nerve, of course, was testing the pupil reactivity, and your pupils were fine. And the trochlear nerve, where we look down and into your eyes look in good health. Now the trigeminal nerve was where do you remember I tried to close your mouth? Got a nice strong jaw, and then I brushed your eyes whilst your eyes were closed, and we tested to see if you would blink, and you did. And the abducens, where you move your eyes from side to side, we did that. And then we tested your facial nerves. All your facial nerves were working, and of course we tested your taste as well by doing the sugar and salt test. So good. Then we tested your acoustic nerve, so your hearing. That was absolutely fine. And then we did the glossopharyngeal and the vagus nerves, all of which were fine as well. Nerve number 11, we moved on to the spinal accessory nerve, where I got you to move your head from side to side whilst shrugging your shoulders. And then to finish, we finished with the hypoglossal nerve, which was where you stuck out your tongue and just moved it side to side, and I had a little look. Okay, so I can say that you have passed this cranial nerve examination with flying colours. Do you have any questions? Okay, great. No, I would say that you look like you're in good health. You look like you're in good shape. You don't have any medical concerns as of right now, but if you do, of course, you can just, come back here. Okay, we're always here to help. But if there's nothing else, then I just want to say thank you so much for being my first cranial nerve examination patient. Honestly, I was a little bit nervous, I have to say, but yeah, I'm just so glad it went well. You're very welcome. Well, it was lovely to meet you, and I hope you enjoy the rest of your day, and yes, maybe see you again soon. Okay then. Alright, bye bye then. Bye. Oh. Good. Oh, wait. Oh no. No, they've got my brain. Oh God. Oh.